What sparked your interest in this particular topic during the ongoing pandemic?
Yeah, so as mentioned, I'm in charge of our STEMI program. So I deal with the data for all of our acute heart attack patients at the Cleveland Clinic and throughout our, uh, our Northeastern Ohio healthcare system. So I think as a clinician, as an interventional cardiologist, I was personally experiencing that. Um, I was encountering patients that we thought were having heart attacks. We take them to the cath lab and we would do coronary angiography, in the acute setting. And we'd find that their coronary arteries look clean. And this happens occasionally, but it seemed to be happening a little bit more in and around the late February timeframe and into early March. And, one of my colleagues, Dr. Ankur Kalram, down at Akron General, I approached him with this idea of maybe we should look at our data. This was really around, mid to late March. They said, it really seems like I'm seeing more patients with this lately. And he said, yeah, me too. It would make a lot of sense because COVID, and this is just a really unprecedented situation, especially earlier on in the pandemic. We had no idea what direction things were going. And we as a healthcare system were really preparing for the absolute worst. And I think that, reading about what had other countries have been experiencing, we were worried, and I think we kind of wanted to hit the ground running and look at this kind of in early time frame so that we can present some information, because I think it's one thing to be able to. It's one thing to say, hey, I think I'm seeing more of this and have case reports, but it's a whole other thing to look at a large number of patients and actually quantify what the risk is, and that's what we wanted to do. So that was the reason. I think it was really just to put data behind our experience and to better explain, what we were seeing, as with all things with research, which is something I feel passionately about, and that's I have a clinical question, and then to put numbers behind it so that you can better support your findings.
All right, thank you for that. Now, just looking briefly, I'll let you dive into them a bit deeper, but just looking briefly at the results. You compared them across 4 historical cohorts, and you found overall that the rate ratio was more than 4 times greater during the ongoing pandemic compared to these historical cohorts. What did this mean for you guys? Obviously, you touched on it a bit during your previous answer, but what did this mean for you guys in terms of a real world setting? What was it like having such an increased rate of these type of patients?
Sure, that's great. So I think it's important to recognize that these are not common patients. Stress cardiomyopathy happens, once in a while. We see it. I think we as cardiologists experience it more than other areas of medicine. But obviously, this is not to say that everyone that has COVID or everyone during the COVID pandemic this is going to happen to. The absolute number of patients who got stress cardiomyopathy was relatively small, but it was about 4 to 5 times higher during the time frame from March 1st to April 30th than it was during these historical time comparisons, which were same duration time frames that we just kind of randomly sampled over the course of time to give a basis of comparison. I think what it meant for us was that when we saw this, we said, yeah, this is exactly what we're seeing, and I think we should report this because it's really one of the first reports of what the true incidence of this is during the COVID pandemic, and then we can look at this through a larger sample and maybe even across institutions to better quantify what the true risk is, but nonetheless, the signal is there. And I think that can maybe raise some eyebrows and alert people in policy positions that, yeah, I mean, the COVID pandemic is serious. It's something which is having profound effects on the patients that have it, but it's also having health effects to people in society that aren't even affected with the virus. And the pandemic itself is affecting us all in such dramatic ways that it's spilling over into our health. And I think this is just one example of that.
Well, I definitely think your study has raised some eyebrows thus far. Another thing I wanted to ask you about, I noted in our coverage of the study that you guys pointed out there was no statistically significant differences in median age or sex between any of the cohorts that you examined. Is there any potential differences you saw between the cohorts that you might want people to keep in mind to avoid overinterpretation of the results of your study?
Yeah, absolutely. So as mentioned, it's a smaller study, 258 patients, and it's a single hospital system. So the results have to be taken in that context and repeated in a larger sample. And I think over time, especially now that we have a few more months under our belt during the COVID pandemic, it'd be great to look at this, within our system and other systems and kind of pool data. So that's one. Comparing it to our sample time periods, I think that the thing to do, well, first I think we made a pretty strong and good effort, a valid effort, to find representative time periods, kind of at a somewhat of a random, but we didn't want to go too far back in the past. We wanted this to be contemporary, right? So I think our comparison groups were very good, and there was really no significant difference in terms of the major findings, or I wouldn't expect to see different results during those time periods. But one thing that would be very interesting to do is to look several years back in larger groups of patients over the exact same months. So like March to April would be very helpful. We don't really have the ability to do that in this study because there's only so many patients that we have available during those time groups. But we feel really confident with what we presented, and I think given the caveats of it being kind of a modest-sized study, I think the results are nonetheless, pretty strong, and I think they help explain what we're seeing clinically.